So a lot of people have been asking me about therapy, how to get the most out of your therapy, what is trauma therapy, so let's talk about it. Most importantly, what I really want to impart in this video, there is no one else exactly like you. There is no expert on your life more than you. So if you're currently in therapy and you feel like things aren't sort of going where you want them to go, where you're not getting as much traction as you'd like to feel, as much benefit, I encourage you to talk to your therapist about it. And I can hear you people pleasers like, what are you even talking about? I'm meant to tell my therapist that I don't feel like I'm getting enough benefit? Yes, this is what I'm encouraging you to do. I am a therapist, but I've also been a longtime client. I know that this can be very scary, but there is no way as a therapist that if I see someone for 50 minutes a week, which is typically what happens, I am going to be able to know exactly what they're experiencing, what's working, what's not working. I rely on my clients to give me that feedback. And sometimes your therapist should flat out ask you, like, how are things going? What's working? What's not working? But if they don't ask, it's okay for you to bring it up. Hey, before we get started, can we sort of take the temperature on how this is going? You can even ask your therapist, how do you think this is going? You can ask your therapist, how do you think things are going? What do you think is working? And then you can say, listen, when we had this session the other day, I left really feeling like that, I had a lot of insight. There was a lot of movement. I walked away with tools, whatever you think the benefit is. But if sometimes you feel like I'm coming in and I'm just reporting my week and I don't really see the benefit of that, it's important to note that, to see what your therapist even has to say about that. When we have these more relational conversations, we can collaboratively work towards what's going to feel best for you. So that's really important feedback. I know what can often happen is people go to therapy wanting to get the gold star, right? Like, my therapist thinks I'm great, as though we're giving you some kind of a stamp of approval that tells you that you're good enough and you're doing well enough. This is not the point of therapy, okay? I say this, and yet I, as a client, have done this a lot. I want my therapist to like me. I want them to think I'm smart and funny and insightful. And they might think those things, but that is not necessarily helpful to me. I remember once early on in my early 20s, I would just flat out lie to my therapist. I would tell my therapist what I thought she wanted to hear. And then, she would take the notes and sort of put it in my chart or file, whatever. And I was like, okay, phew, fooled her. And guess what? I walked out feeling like, oh man, I fooled her. And now, oh God, I've lied. And how am I meant to go back and clean that up? Well, I can't tell her I'm a liar, right? And so I kind of created this whole dynamic where this thing was not going to be helpful to me. So if you are looking for a gold star in therapy and you're maybe hiding some things, maybe you're actively lying, maybe there's just lying by omission, there's all the stuff that you're not talking about, I want to encourage you to ask yourself, what am I not talking about? And can I imagine bringing it in to therapy? Oftentimes, I will tell people, give me like the subtext around the thing itself. So if that were me as a client, I might go to my therapist if I were lying and go, okay, I have to admit something to you. This feels terrible. I'm so ashamed, but I lied the other day when you asked me how much I was drinking, and I told you I was drinking like 1 or 2 drinks a week. It's actually like 2 or 3 drinks a night. That's not happening right now. I'm just giving you an example of what sometimes people come into my office and say. So you just tell them, like, this feels hard to say. Oh, I think that you're maybe going to feel badly that I lied. You're going to, think that I'm a jerk. Whatever it is, say all of those things and then say the actual thing so that you can have actual benefit from your therapy, right? It's so important that we can be honest. Even if we have been dishonest, it's never too late to start right now with taking back your therapy and making it helpful for you. So along those lines, in giving feedback, if you feel like a therapist is trying something, they've given you an intervention, a task, an assignment, either in or out of session, and you don't want to do it, you know you're not going to do it, you did it and you hated it, this is valuable information. In fact, this is gold. Again, for my people pleasers, we want to be good clients. We want to be compliant. We want to be the best client, but that might not be what's best for your own nervous system. That might not be what's best for you at all. So if I ever suggest something and a client's like, they're not feeling it for whatever reason, I go, okay, cool. We're going to try something else. Okay. We don't just have a one size fits all toolkit. We have I have all these, what about this thing? Oh, how does that feel? Oh, it feels terrible. Oh God, throw that out. Okay. I'm going to go back to my toolbox. Most therapists should be able to do this or explore the resistance, not as a way to go, okay, you're bad, and now I'm going to figure out what I need to do to push you over the finish line. It should not be a shaming process. But sometimes when we unpack the resistance, we go, oh, well, this was the thing that I'm afraid of. And then we can bring some support to that fear. Again, it's collaborative. We need to know as therapists what's working, what's not. It's all okay. That's the thing I really want you to hear. It's okay if you don't like it. If you don't like something that your therapist said, if you felt offended, if you were carrying it around all week and you're like, that was really judgmental. One of the most impactful therapy sessions of my life as a client, I was seeing this male therapist. I was in graduate school. And when I first went to see him, he had a cross up on his wall. And so I asked him about that. I said, I'm wondering about the cross. I'm wondering how your religious views might form your opinions on things, your values, how your values might impact your ability to hold space for things I'm going to want to talk about in here, including relationships and sexuality. And he said, oh, don't even worry about it. Yes, that is my cross, and this is a safe space. So I was like, cool. So it turns out it was not a safe space. When I did delve into some of these topics, he was like, he was pathologizing me. He was seeing it through his particular lens. It didn't feel good to me. I felt very shamed and judged. And what I wanted to do was ghost the therapist. I wanted to just never go back again because, that's healthy coping, right? What my friends at the time encouraged me to do was to go back and tell this therapist why what happened didn't feel good. And this to me is like therapy gold because we can kind of practice things in therapy that still feel really hard. Like, I don't want to hurt his feelings. I don't want to be in conflict. I don't want to bring this to his attention. But I also wasn't doing that in the rest of my life either. And so therapy was a chance to practice having a voice. And so I did. I went back the next week and I shared what I experienced and why it didn't feel good. And basically he said, I can understand why it didn't feel good. And I would do the same thing today. Like, didn't think that he really did anything wrong. He understood that it hurt my feelings, but he kind of doubled down. So I was like, okay, in the moment, I just knew in my body, I cannot work with you anymore. And I was able to break up with a therapist, and I'm checking my memory here, but yes, I believe it's true. And it was a male therapist, which feels significant because I had never at that point in time broken up with a boyfriend my entire life. Okay, I was in my 30s at this point. Since my first 5th grade boyfriend, I had never said, this isn't working for me and here's why in my life. And I got to do that with this therapist. And I walked out of that office that day like so proud of myself, feeling my worth, feeling my agency, knowing I had a voice. And that session was, if that's all that I got out of that therapy, which it just might be, it was worth it because I was able to have a new experience for me. It didn't matter what he took home with him at the end of that day. I got to have this new experience. So by bringing my authentic self to the relationship, no matter what, I got to win that day. So back to this idea of noticing what you're experiencing and being able to communicate it to your therapist. Trauma therapy in particular is a very body-based, nervous system driven, experiential type of therapy. It's not an analytical therapy where it's, yes, I'm going to say something very clever and smart and you're going to agree and we're going to unpack that further. It's much more about, what are you noticing now? It could be feelings, it could be sensations, it could be memories or imagery. There's no right or wrong. Everybody processes differently. But you're adopting this sort of witness consciousness to go, well, what am I experiencing? Well, right now I'm feeling nervous and there's butterflies in my stomach and my chest feels hollow. That is all brilliant information to give to your therapist that they would never know unless you told them. So what are you noticing? What are you experiencing? This is the gold in trauma therapy, not what you think you should say, because there's no wrong answer. There's only you and what's happening in the moment. Okay, so this is my personal bias. So I will say that for my whole career, I've tended to be very relational, meaning I am not a blank slate in therapy. I'm a real person with a real, soft sweater, and I'm gonna tell my clients what's coming up for me in relation to them. I'm willing to self-disclose, obviously, now that you see me here on social media talking about my personal experiences. I've always been someone who, when it felt like it applied to my client, would be willing to say, I have personal experience with that. Here's how that has impacted me. And I do that for a couple of reasons. One is a shared experience to reduce the shame. Sometimes people are like, oh man, you're not going to understand. And it's like, well, I might, because I have this experience. And sometimes my actual experience feels helpful to the other person. Sometimes I'm just pointing out my bias. So I go, I've had this experience and it looked like this. In other words, that might inform the way I'm viewing your experience. So let's both be careful. Let me be careful that I'm not just superimposing my experience onto yours. But anyway, this idea of the blank slate is a very classic Freudian sort of the analyst, where you're going to lay on the couch and free associate anything that comes up. Any questions that you have, a therapist is likely going to say, well, I wonder why you would ask me that question. They sort of put this back in your lap to go back into the subconscious and continue to free associate. This can be a very useful therapy for a lot of folks. I know many people who have seen an analyst for years and they loved it. For me and for many trauma survivors, a blank slate can be re-traumatizing. Particularly what I'm talking about, which is relational trauma, right? Childhood trauma, developmental trauma, complex trauma is relational trauma. So if I have trauma related to who am I and how do I feel about me, and I've been wounded by people again and again and again in a relationship, and I'm trying to unpack that with someone who's basically like, well, how do you think about that? What does that mean to you? Well, why would you think that I feel this way? It's like, no. I need to practice having a real relationship with a real person in the room. It was very crazy making to me to have a therapist who couldn't just be a real person. It made me feel invisible, like I felt growing up when I got the silent treatment and I was punished and I was shamed. It ignited all of those things, and then I had nowhere to go with them. So oftentimes, regardless of whatever orientation a therapist has, it's very useful if they can be relational, collaborative. I'm in the room with you. I'm holding space with you. Yes, I'm seeing what you're seeing. I'm here too. You're going to even borrow my nervous system in terms of co-regulating. Even as I say those words, I go, ooh, safety. My body goes, yes, that feels so much better. So that collaborative piece tends to be, that relational piece tends to be important for trauma survivors. Okay, and then there is what are specific trauma therapies. So if you're working with a therapist and you're not sure if they're a trauma therapist, again, you can ask them. Ask them, do you have any specific trauma trainings? Are you familiar with complex trauma? If they don't, and if they aren't, some therapists, you might have a long-standing relationship with a therapist that you've gotten so much out of it, right? And you're like, oh, I don't want to let this go just because they're not a complex trauma person. Sometimes you can bring to your therapist, hey, have you read this book, right? I've heard from a lot of people who take a video or a reel of mine on Instagram and they go, I shared it with my therapist. And I go, oh, that's awesome. Because now you're being that collaborative client saying, this is what I'm interested in. This is what I'm curious about. What do you think about this for me? And oftentimes a therapist can go do their own homework, do their own work if it feels like a good fit to them. And you guys can continue to stay on that path together. Other times what it might reveal is a therapist goes, you know what? No, I'm a straight ahead CBT person working with anxiety. I don't work with trauma. And let's find you a trauma therapist. And they can be helpful even in helping you to look for someone who might be a better fit for that piece of things, and to bridge the treatment, even to talk to the new therapist and give them more of the landscape of where you guys have been, so you can kind of carry that history with you to the degree that you can. And if you're not working with a therapist and you're looking to work with a therapist, I am not taking new clients. I know people often ask. I will likely be doing some workshops or classes in the new year. You can go to my website, ingridclayton.com, and sign up for my newsletter if you're interested in that. But those will not be one-on-one therapy. So if you're really interested in one-on-one therapy, I suggest, if you're in the States, the Psychology Today Directory of Therapists tends to be pretty comprehensive. It's like once you graduate and get licensed, Psychology Today comes knocking on your door. Would you like to be in our directory? And most people say, yes, I would. And you get bios and websites and expertise, information from therapists all over the country. You can search by zip code, you can search by specialty. And what I tend to tell people is to ask them, well, first of all, check the box that says trauma. And then see if they have experience with complex trauma, with relational trauma, and what modalities they use. They should have at least, if they're saying they work with trauma and that's a specialty, they should have at least one trauma modality, if not two, sometimes three. People tend to be sort of eclectic in their approaches and can kind of wed different ones together. So those are important questions to ask. And then you can say in a consultation phone call or a consultation appointment, here's what I'm dealing with. How do you think you can help me? You can ask them directly, right? Do you work with complex trauma? Here's a little of my experience. Do you have experience working with these things? Do you think you can help me? Therapists should absolutely be able to answer these questions. In the case of narcissistic abuse, to be honest, this is not something in my experience that many therapists have had specific training on. We get a little bit of training in graduate school related to personality disorders, but that's more what that narcissistic personality disorder looks like, not so much in what it does to a survivor, someone who's lived through narcissistic abuse. So there's not going to be a checkbox likely, but you can say, what's your experience working with narcissistic abuse or emotional abuse as sort of a more general term or experience? They should be able to answer these questions. And this list is not exhaustive, okay? There are probably many, many more types of trauma therapies, but the ones that I have used in my practice or as a client or have heard a great deal about are EMDR, which stands for eye movement desensitization and reprocessing. It's a mouthful, but it's EMDR. As a clinician, many of my clients have responded well to EMDR, and many have not, to be honest. So again, it's this like, how does this work for my nervous system? And if it doesn't feel after many sessions of trying reprocessing that you're getting any traction, it might not be a good fit for you. But that's a biggie that many people are trained in. So oftentimes I think it might be easier to find an EMDR therapist than some of the other modalities. But then there's also somatic experiencing. If you've read my memoir on complex trauma, I've written about a couple somatic experiencing sessions as a client that were really impactful for me. There's IFS, Internal Family Systems, which I don't really think, in my opinion, is the best name for the therapy, because it sounds like the way that maybe you're holding all of your family members internally. I don't know. It doesn't feel like that in the room. In the room, it feels like I get to be a whole person by examining the different parts of me that show up for different reasons at different points in time. And when we differentiate these different parts, it's a way to sort of open up and look at their function, their needs, and to really be present to them. It's like you're kind of giving healing to each individual part of you and then seeing how they can operate in the whole system. I probably didn't do a great job explaining it, but very helpful for complex trauma survivors in particular. There are a couple of CBT modalities that are very well researched, lots of data, CPT and PE, prolonged exposure. I don't have personal experience with those, but again, lots of data related to their efficacy. There's psychodrama, there's all kinds of things. Ask the person what they specialize in, and again, how they think that would be helpful for you. And then if you feel like, it sounds interesting, I feel like the therapist might be a good fit for some reason, it's trial and error. Okay, we just have to show up and go, okay, I'm going to see how this feels to me. If it doesn't feel good, if it doesn't feel like it's working, it's not that you're broken. It's not that you're doing anything wrong. You can explore those things with a therapist. Like, is there stuff that might be getting in the way? And maybe you can do something about that. But it also just might be that modality is not the best modality for you. And that's okay. My name is Dr. Ingrid Clayton. I'm a clinical psychologist, a trauma therapist, and a trauma survivor. I'm the author of Believing Me, a memoir on complex trauma and narcissistic abuse. I'd love to hear your comments about what therapies have been most helpful for you as someone with complex trauma or as a narcissistic abuse survivor. What worked, what didn't work, and be sure to subscribe to this channel so we can continue the conversation. Thanks for being here.